So, Andrea, how can I help you?
Well, I've been having an issue at work and it's just really starting to affect me.
Well, tell me a little bit more about that.
Well, there's our office manager at work can tend to be a little demeaning, and a lot of times I just don't feel real supported as far as when I do my job, especially in front of patients. And it's really starting to affect how I feel about myself.
So that sounds like that's a bit stressful.
Yeah, it is a little bit. Yeah, sometimes you just don't know what you're going to walk into when you go to work. You know, you're doing your best and doing your job on a day-to-day basis, and then out of nowhere you feel like you're thrown under the bus.
So is this something that just started happening, or is this something that's been going on for a long time?
Well, I've been there for about a year, and I really didn't notice it at first. But as time went on, I started to notice some comments here and there, and not just to me, but to other employees as well. And so I know it's not specifically geared at me, but I'm having a hard time not taking these things personally. And it's really affecting, like I said, kind of my self-worth at this point.
So tell me a little bit about as far as the way it's affecting you.
You know, I've been doing my job for 7.5 years, and I'll never say I'm the best, but I feel that I am good at what I do, and I genuinely care about my patients and do the best that I can each day that I go in. And when I feel like I'm thrown under the bus out of nowhere, it really makes me start to question my ability to do what I do. And then when comments are made in front of patients, I feel that makes me lack credibility in the patient's eyes.
So it sounds like it's a personal attack.
Yeah, I'm having a hard time not taking it personally. Like I said, you know, I'm not the only one that this happens to. It's happened to others in the office as well, and so I know it's more of this person's personality to act that way. And I know that in my head, but in my heart, as a person, it hurts my feelings, and I'm taking it personally, and I'm internalizing it.
So so you're saying that for you it's affecting you personally, and not just and your credibility is being called to question because you have an educational degree in this particular field.
Right.
Yeah.
Right.
Yeah.
And so it makes it difficult when this person does not have the same education in the field that I have, and I don't know. I just feel like it's supposed to be a team, and I don't feel like I'm being supported. And like I said, it's not just me; it's other people in the office as well, and it's this person's personality, and I just don't know how to get past that and not take it personally at this point.
So it sounds like you're somewhat afraid to say how you actually feel while you're at work.
Yes. I am afraid if I try to talk to this person about it, that it will just kind of be blown off like, no, that's not it. You know, that's not what happened. It just won't be. I don't feel there would be any resolution if I did try to confront it and address it.
So it sounds a little bit frustrating.
It's very frustrating, yes. like I said, just because on a day-to-day basis, I don't know what's going to happen when I'm there with me or any other employee.
So it sounds like you believe that you feel hopeless.
I do. I do feel hopeless in this situation because I don't know how to make it better. I don't think trying to address it and confront it with this person's going to make a difference. And if it does have any impact, I think it's going to end up being negatively impacted on me, because I feel like maybe this person might feel attacked, which is exactly how I feel, and I don't want to come across that way.
It sounds like you're avoiding the situation somewhat.
Very, very much so. Very much so. I just, when a situation occurs, from that point on the rest of the day, I don't say a whole lot. I keep to myself and just do what I need to do.
And as a result, it's affecting you, your behaviors, it's affecting your emotions, how you feel.
Very much so.
Yes. So, if you could, you've talked to me about the stress that it's causing you, as far as you're working in the environment that you're working with, and you've shared with me that it causes you to avoid coming into contact with that person.
Right.
For fear of what will be said or won't be said, or that your credibility is being affected, the fact that you have a degree in your field and the individual who is speaking to you may not have the same credentials, and so it sounds like you're a bit frustrated, and you're having feelings of hopelessness, and you're not sure in what direction you're going.
Correct.
So you want to talk about and maybe address some of those issues.
Right.
Is that correct?
Yes. Yes.
So with those issues that you've shared, tell me, what concern would you see as most important and where you would like to begin?
That's a toss-up. I would like to be able to not take it personally ever, and I'd also like to be able to address it without fear of retaliation.
Those two are very, very good points. Between the two, just to focus on one, tell me where we can get started.
I think learning to address the person and feeling comfortable with doing so would probably be the biggest, because I think that however it may turn out, good or bad, I think long term that's going to help me in many other situations as well, not being afraid.
So not being afraid to be able to speak with someone without them retaliating, and addressing the circumstance so as to feel comfortable working in the environment.
Right.
Okay.
Absolutely.
So tell me where you would like to see yourself in 3 months.
In 3 months, I would like to be able to say that I've got the confidence and the ability to address a situation without hesitation, and regardless of what the outcome may or may not be. I think that a lot of times I'm assuming I know what the outcome's going to be, and so I need to get over that fear and just be comfortable. And so in 3 months, I would like to be able to say, that that's not an issue any longer.
So that sounds like a really great goal. Those goals seem to be very reachable and within reason. So we can put together a plan of action, a plan of treatment that maybe would work well for you. And we'll be discussing that. I'm going to make my notes. I'll talk to my supervisor and get his advice.
Okay.
And then put together something I think that would work really well for you. And of course, you would have the say because you're the expert in your own self and you know what works for you. So your opinion is very much valued in this circumstance. So all of these feelings that you're having